Good afternoon, everybody. I hope you had an exciting Super Bowl Sunday. Here with Josh and Paul. Cut to the chase here for our COVID daily summary. Over the last 3 days, tests reported 122,000. We're now over 6 million tests have been administered in Connecticut, some of the highest per capita in the country, and better than 2 per person. Positivity staying consistent and going down a little bit at 3.6%. Sort of interesting. We're a little more than Massachusetts and less than New York, but the trend has gone down. The trend that from upper New England to southern New England and New York. So we're following that. Hospitalizations continue down, lowest in a few months, and fatalities, that's a 3-day number at 68. It's worth noting that even fatalities are about half where they were a month ago. So the trend lines are all positive. And what does that mean? It means that we looked at February 9th as a date, what to do with the executive orders. We're going to roll over those executive orders till April 20th per agreement with the legislature, but not necessarily every executive order. And most of the executive orders are deregulatory things that we allow people easier to do. And we're going to be taking a look at that. We're going to be taking a look at, this is the start of the sports season. Winter sports competition begins today. So we'll be looking at the size of events and size of, crowds at sports events. We'll decide that probably in the next week or so. But one EO that we're not going to extend past on February 9th is for immunity for our nursing homes and hospitals. That immunity will end on March 1st. You say, why? Why'd you have immunity in the first place? I think if you remember back in March, April, May, COVID was hitting us hard. We were bringing in a lot of retired folks and others, retired nurses and others who are there to help out in the hospitals, help out in nursing homes, trying to keep up with something we were learning about every day. And at that point, it was unfair. We thought to hold people legally accountable for a situation that was so fast evolving. And when it comes to our hospitals and nursing homes today, we're in a very different situation. Good capacity. Folks are vaccinated in the hospitals and nursing homes. Things have stabilized. So while the workers continue their immunity, the facilities, the hospitals and nursing homes, that immunity will end on March 1st. Here's the vaccine update. Still doing very well as national leader in terms of making sure of all the vaccines allocated to Connecticut, we get the shot in the arm. And that we feel very confident about and can continue to do that and could take 10 times as many vaccines if they were available to us. About 56% of those that are our priority groups, 75 and above, have now been vaccinated. Nursing homes have been vaccinated. And you may see, Josh reminds me, in terms of the numbers in the nursing homes, in terms of infections, in terms of complications and fatalities, that number has gone down dramatically at our nursing homes compared to where we were months ago. That shows you the vaccines work, they're safe and effective. Other priorities in our vaccination program is those socially vulnerable communities. And we're also preparing for the 65 and above population, moving the threshold from 75 and above down to 65 and above. And I'll explain that right now. So as of Thursday, as in 3 days, you can start signing up for those who are 65 and above. You may say, what's going on? I see you only had 56% of your 75 and above vaccinated so far. And that's true. But we are finding that, the first 20, 30, 40, 50% are much more likely to want to get vaccinated. Now there's a little bit more hesitancy, and I want to make sure that there are no vaccines left behind and that every vaccine is a shot in the arm. So those providers that have an extra vaccine at the end of the day, they'll be available right now for people over the age of 65. They can reach out and tell you. More importantly, for everybody else, 65 to 74, 65 and above, to be blunt, you're going to be able to sign up. You'll be contacted by your healthcare provider. You'll go to CT.gov, COVID vaccine, and they will be available. That's 350,000 residents. So that's a good size of our population, but many of them have been vaccinated already. Many of them, for example, are in nursing homes. So I'd like to think that we'll be able to move through the 65 and above population relatively quickly. Next is our focus on equity. I mean, we're doing 65 and above because 88% of the fatalities related to people 65 and above. Half the hospitalizations related to people 65 and above. They're only 18% of the population. So that is a priority. But our focus on equity are also those socially vulnerable groups that we often have to work to make sure they get vaccinated. They want to get vaccinated. And here we're making a big priority. Those that are in congested communities, those that are in multi-generational housing, often people of color. A big priority for us to make sure they get vaccinated, keep them safe, their communities safe. So we'll be increasing the state allocation to those under-vaccinated areas to make sure that they know they have the vaccine available when they're ready. Working the federal pharmacy sites and targeting some of those CVS and Walgreens to more densely populated areas or more remote areas where perhaps you don't necessarily have a drive-through clinic that makes it easier for you to do. Michelle Gilman is amazing. She's working with our state and local public health departments and healthcare providers, working town by town, making sure we can find those populations, how best to reach those populations. We're talking, it sounds like a GOTV operation, not get out the vote, but get out the vaccine. And what it means in terms of reaching out to those local communities, finding trusted voices within that community, be they clergy, be they aldermen in New Haven, who tell you now's the time to get vaccinated. You can do it safely and you can do it effectively. And that's a big priority for us. And maybe you saw local TV, we had our PSAs, public service announcements about the importance of getting vaccinated during the Super Bowl. And finally, 65 plus, what to expect. No surprises here. Our only limiting factor is the number of vaccines that we're getting. We're still at about 58,000 for this current week. Probably by the end of the week, we'll get an additional 11,000. Those are the ones that go directly to the pharmacies. And over and above that, we'll be getting second doses. So in and around 100,000. Like to see that number ramping up. Scott Gottlieb says we can expect to see that number ramping up relatively soon. It will probably take a month to get all the 65 plus vaccinated, depending upon folks' appetite and interest in getting vaccinated and how fast we can do that. And one last thought before open it up to Josh and Paul and your questions. There's a lot of interest and excitement, especially now, 65 and above, opportunity to get vaccinated, really able to deal with the heart of our population, of the folks most likely to suffer complications and beyond. And I just got to urge a little bit of patience. I know down in Florida, they open it up, they say first come, first serve, and within 93 seconds, every slot is taken. But we do have the 211 phone lines. We do have the outreach going on with the healthcare providers. We do have the website. And bear with us because there are a lot of people, 350,000 people, who are now going to be eligible in this next category. It's going to take us a while to get everybody vaccinated, even take us a while to get everybody an appointment. But you will get an appointment, you will get vaccinated, and we'll do it over the course of the next month. Max, any questions?
NBC Connecticut.
Good afternoon. You mentioned Dr. Scott Gottlieb, and I wanted to ask you about a quote on CNBC today from him. He said, "We're going to run out of demand sooner than we think at some point in March, and certainly by the end of March, we're going to have to make this generally available. Everyone is going to be able to go online and get an appointment sooner than we think." Does that match our state's projections?
Well, there are two big variables in that. A, how fast Moderna and Pfizer and soon J&J get vaccines to us so we see what the supply is. and how good a job we can do in convincing populations, some of whom still have some hesitancy that you got to get vaccinated. Now is the time to get vaccinated. So I'm not sure that supply will outstrip demand as quickly as Dr. Gottlieb has suggested, but we talk about it a fair amount. He is a Connecticut resident, and I'd like to think that we get that supply of vaccines ramped up as quickly as he thinks we can.
Would you say overall we're on schedule or ahead of schedule from what you were looking at when the vaccine first became available?
I think we're on schedule. I think this is what we projected. Obviously, we had a couple of snow days in there. We caught up by the end of Sunday. But this schedule, I'd love to see it accelerated. I'd love to see it accelerated by a factor of 3 or 5. And we've talked to Pfizer, talked to Moderna. Everybody knows our appetite for vaccines. Okay, and lastly, I know you've been asked several times over the last couple of months when you'll get your vaccine. It sounds like your number's been called now. What are your plans? Are you going to get vaccinated? I think I'll talk to our public health, and I'd like to think I'm in the next week or so if everything works out. Thank you.
News 8.
Governor, you're on the Pandemic and Disaster Response Task Force. You're mentioning that there's a bottleneck with supply and the machines. What are you seeing that you've been on the task force now a week or two as far as supply coming out of Washington?
The good news on supply out of Washington is, some clarity, so we can think out 3 weeks in advance. You've heard Josh describe that. A little less clarity in terms of how fast we think we can ramp up that supply of vaccines. But we're trying to track that as carefully as we can right now. We heard some relatively good news from Pfizer recently, but I'm going to wait to get the allocation from the Fed so we can count on it.
All right, and then you also mentioned distribution through pharmacies. You can handle 10 times the supply coming in. Where are the pharmacies at right now? Because I believe with 65 and older, that's majority of them are going to be going to the pharmacies.
Yeah, we've ramped up pharmacies. Hey, Josh, you know how many pharmacies we have right now and maybe what the schedule could be over the next couple of weeks?
Yeah, absolutely. So we've already supported opening about 24 pharmacies around the state out of our own state allocation, prioritizing pharmacies in some of our cities, some of the more rural areas. We've also given doses to 7 Walmarts in high SVI communities around the state that are opening up as of today. So we've gotten a good start there, but now the federal pharmacy program is coming in on top with a dedicated vaccine supply that doesn't have to come out of our allocation. And that's going to mean another 60 pharmacies between CVS and Walgreens coming on starting on Friday and phasing up over the next week or so with another 11,000 doses across those 60 CVS and Walgreens locations. And we've been working with CVS and Walgreens to make sure the sites that they open up, again, are focused on our high SVI communities, as well as some of the rural corners of the state that have less access. So that's going to be a really valuable addition to our vaccine coverage. But again, 65 and older can get vaccine at another 120 locations around the state as well. So it's just one additional set of resources for us.
And finally, Northern Correctional, to go off topic, you're closing that this summer. Why? Pandemic related? Will we need it again? Is it going to be mothballed? Kind of your ideas, thoughts behind it?
I think we're closing it. I don't think we're mothballing it. As you know, our incarcerated population is at historic lows. It had a very, very low occupancy rate. There was no real reason to keep it open any longer. Paul, anything to add on that question?
No, Governor, I'll just add that our incarceration rate right now is at a 30-year low, as the governor stated. Northern was a facility that was built at a different time of justice in a lot of ways. The governor has been focused working with Commissioner Quiros and the rest of the team about making sure that we have a fully modernized justice system that's fully all around, making sure that the individuals who are there in a manner that is safe, but also when they do come out, that they'll be appropriate members of back in our society. And Northern just doesn't fit that based upon many reasons.
Thank you.
Channel 3 Eyewitness News.
Yes, Governor, just a real quick question on the 65 and older population. You're saying that they can start signing up on Thursday, but we're seeing many local health districts telling them that they can sign up now. And you can also sign up on the VAMS website as well, being 65 and older.
Well, I think the official date is this coming Thursday, where we formally open the door to 65 and above. But as I alluded to before, some of the smaller towns have, certainly vaccinated a vast majority of this, the 75 and above. Some places do have extra doses now at the end of the day. So they are making some vaccines available, at least the excess vaccines, to 65 and above. Thursday's the real day, though.
Got it. And, if legal immunity at the nursing home ends on March 1st, does that mean that visitations could resume soon as well?
I think so. We've got everybody vaccinated there. I think this is a time where we ought to be able to take a look at that. Josh, anything to add?
Yeah, the requirements around visitation in nursing homes is really dictated by the federal CMS regulations. And the good news is that as the infection rate has come down in the state, and also as the number of nursing homes that haven't had a new case amongst their residents or staff for over 2 weeks has gotten to be a very high percentage of the total, that many nursing homes now are in fact able to resume controlled visitation in a safe way. So that's a really good step forward.
Fox 61.
Hi, Governor. How many doses per week do you anticipate will be able to go to those ages 65 and older?
I think you're going to see almost all of them going to the 65 and over. Maybe there's still another probably couple of weeks of 75 and above who have some appointments. They're coming in. Maybe some of them are waiting to see their friends get the vaccine. They'll come in. But I say the other 90% of the doses will be going to 65 and over very soon.
And then just to confirm, so it's up to the individual providers to begin opening up appointments for those ages 65 and older. For example, if they're still working on those ages 75 and older in their region, they will make the decision when to open up for those ages 65?
No, everybody will be available on Thursday for 65 and over. You can go to the website and sign on and go through maybe the drive-in through clinic at Rentschler Field, the CVS or Walgreens site. They'll be making appointments as well, but everybody 65 and over will now be in the queue.
Thank you.
News 12 Connecticut.
Hi, Governor. So now that we're opening it up to 65 and over, are we still on track, you think, for early March for the first round of essential workers?
We'll see on that, John, but I think so. I think we ought to be able to get through the 65 and over, depending on supply, depending upon the appetite to get vaccinated within a month or so. So I don't know if it's early March, but sometime in March, yes.
And we get a lot of questions about people with underlying chronic conditions, the so-called comorbidities. Are you thinking that they're going to come on at the same time as the essential workers? Would they come on afterwards?
I think at the same time. I mean, we'll have to figure out how that is done, how doctors reach out to those that have a pre-existing condition and say, you are now eligible to get a vaccine, come in and get vaccinated, so that we do it in a thoughtful way. But the answer is yes.
All right, and just one last question. We've had about a week now since the restaurants were allowed to stay open later. How do you think it's going? Any issues? You looking at maybe giving them another hour or two now that they've been open?
Well, let's wait and see. But I think the extra hours work pretty well. You know, it's worth pointing out, we have 50% capacity. A lot of our neighboring states are a lot less than that. So we all have gone our slightly different ways. But I think the restaurants have handled it well. I have not heard of any excesses over the Super Bowl weekend. So I think so far, so good.
Thanks, everybody.
WTIC 1080 News. The Waterbury Republican American.
Thanks, Max. Governor, you mentioned that you're going to be increasing allocations to underserved communities based on the social vulnerability index. Could you elaborate a little bit more on what does that mean? Doses or what?
Yeah,
what
that
specifics
means make sure the pharmacies are not just in the suburbs, but located in some of those communities, make it easier for people. Make sure they have the doses, the vaccine doses, so they don't run out and people are eligible to do it. Paul, make sure we have those mobile vans and that we can take the vaccine to you if you can't come to the vaccine. Sort of a little bit like the program we saw in Waterbury the other day.
And I believe Josh mentioned, was it Walmart? 7 Walmarts are going to be set up in SDI communities. Could you please identify those communities?
Sure. I'll just quickly hit the towns. So there are Walmarts in Hartford, New Haven, North Windham, Norwalk, Torrington, Waterbury, and West Haven.
Okay.
Reminder to folks, these are all, as with everything we've been doing related to our vaccination programs, these are all by appointment. So don't just show up at one of those sites. You won't get an appointment. You won't get a vaccine. You need to go on through in that case, Walmart or whatever the provider is. You need to go in through their access channels, either their website or their phone line, book an appointment, and then you can go.
And how are you using the SBI index to target these communities? And are there others that are going to be? Are there other towns in line to have these sites set up that are high on the SBI scale?
Yes, there are. So, each city and town is, as the governor alluded to earlier with the GOTV analogy, is it has its own unique characteristics of, in particular, providers, right? Whether it's hospitals, federally qualified health centers, pharmacies, local health departments. And so what is happening at that local level is looking at where we have capacity, where we have gaps, how we get organized, how we fill it in. And so thinking about which pharmacies to prioritize in which communities is part of that discussion, and making sure we're pushing forward with the pharmacies where we have a gap we think we need to fill. Maybe we need to get caught up on our vaccination rates, a particular neighborhood even that might be underserved. So there's a lot of discussions that go into that selection, and there will be more pharmacies to come.
Governor, there was a news conference off topic here. There was a news conference today by some activists and some Black and Latino legislators that are proposing, that are backing legislation that proposes to accelerate the transition to the latest ECS formula. Basically, they don't want to wait till 2028. They would like to see that implemented in 2022, fiscal year 2022, and they say that would be $420 million for school districts, some of the lowest performing, neediest school districts in the state. Are you going to be proposing, you proposed something similar, I think 2 years ago. Are you going to be proposing any kind of changes along that line in your budget plan?
Well, I don't know about changes, but I am going to be proposing that we're going to absolutely honor the ECS formula that the legislature put in place now a few years ago, which does increase the amount of funding that goes to those most distressed schools over a period of time. And Paul, over and above that, we'll have hundreds of millions of dollars of federal money that we're getting devoted to education, many of that going to a lot of those same schools. And finally, talk about education equity. I'm just so happy that all those districts, in particular those urban districts, have schools that are open and the kids can go to school and pick up their learning.
Okay, thank you very much.
The Associated Press.
Thank you, Max. Governor, good afternoon. There have been reports that the CDC's VAM system, the appointment system, has had some problems, and some states have been abandoning it. How's it been working out for Connecticut, and what issues are we seeing, and why are we still using it?
Well, I'll start and then quickly pass the baton to Josh. But you're right. I think it was a little clunky early on. They're making great improvements on it along the way. We're working on a new portal or interface to make it easier for folks to be able to interface with the VAMS portal. So rather than throw it out, I think we're working on those improvements. But Josh, you want to elaborate?
Yeah, that's exactly right, Governor. Look, every state is struggling with similar challenges, whether they're using VAMs or whether they're using some other system. We're in regular dialogue with our other states, and the challenges we've experienced are pretty consistent. I think it often has a lot to do with the fact that you're introducing a new technology platform that, by definition, usually new technology platforms have new features that you want to add, you want to continue to improve it. But in this case, it's being rolled out first to, the most elderly, the folks who maybe have the greatest challenges using it. So a little bit of a perfect storm there. I think we're through the worst of that. I think as we get to people who are more likely to have email addresses, people who are more likely to be comfortable doing things online, I think it'll become less of a challenge. But nonetheless, as the governor said, we are, in addition, building a new front end to make it easier for people to identify locations that have vaccine appointments available, that I think will be helpful, and that should be available in the next couple of weeks.
Oh, great. Thanks for that. Also, do we have any data regarding how many homeless people may have contracted COVID? And where do things stand right now with vaccinating not only people in the shelters, but also reaching people who may be unfortunately living out on the streets?
Go ahead, Josh.
Yeah, this is part of why we've prioritized congregate settings in parallel to this phase 1B. And we have a lot of our providers around the state who are starting to work their way through those emergency shelters, both hospitals, local health departments. They're using portions of their allocation to go into those facilities and vaccinate folks who may be experiencing homeless and others. So that's back to what the governor was describing earlier, too, about making sure that we're providing the folks doing vaccinations in those high SPI communities adequate resources to work their way through. It's a lot of work, right? You have to. It's oftentimes mobilization to go into a site for a day to do a relatively small number of people, but it's critically important work, and we're really proud that our providers are taking it on.
Do we have any data, Josh, in terms of how many homeless people may have contracted COVID?
I don't have that data, Sue. I can ask around and see if anyone does have that.
Okay. And a quick question regarding the northern closure. Did the lawsuit that was filed last week regarding mentally ill patients, inmates, have anything to do with the closure announcement?
We've been looking at Northern for a while and didn't think it was appropriate to keep it open unnecessarily. But, Paul, anything to add on that?
No, so that lawsuit had no bearings on the decision that the governor, working in conjunction with and the directive he provided to the commissioner on this decision.
I'm sorry, one more quick one. Governor, you said probably it'll take a month to get people 65 and older vaccinated. Is that just with one shot or with two?
The first shot.
Go ahead, one shot.
Yeah, sorry, that's to get their first shot.
Okay, I thought so. I just wanted to clarify. Thanks a lot, everyone.
Thanks, Sue.
CT News Junkie.
Thanks, Max. Governor, some folks in your party have, I guess, moved away from the idea of asking the federal government for a reinsurance waiver. Do you support that decision?
Can anybody hear that?
Cannot.
Am I shouting that question?
I said some folks in your party apparently have backed away from the idea of asking the federal government for a reinsurance waiver. Do you support that?
Look, I think the reinsurance plan makes sense. It's a way that you can bring down healthcare costs on the exchange and beyond for everybody if the riskiest population is subject to that reinsurance plan, and you do get substantial subsidies from the federal government. So if anybody's backing away from that, we should sit down and talk and tell me why.
Do you think an assessment on insurance companies won't be passed on to consumers?
The assessment, if it's paid for by an assessment on the insurance companies, it replaces another fee that was already there. Whether they pass that along to customers or not depends upon the competitiveness of the market.
Okay, thank you.
Connecticut Public Media.
Good afternoon. Is there a plan for more mass vaccination sites throughout the state?
I think we are adding on more mass vaccination sites. Our limitation is not mass vaccination sites. Our limitation is vaccines. And B, as you know, not all the most vulnerable populations can get to a mass vaccination site. But if supply ramps up the way we think it might over the next few months, we're going to make sure we have the capacity to get people vaccinated.
The Hartford Courant.
Hi, Governor. Did New York's decision to expand vaccination eligibility to those 65 plus a few weeks ago factor at all into your decision here in Connecticut?
Not so much. Look, it makes good sense. It's a population, you know, the 75 and above, then 65 and above, by far the most vulnerable. If you really want to deal with fatalities, if you want to deal with hospitalizations, it makes the most sense. People 65 and over, sadly, are more likely to have comorbidities. So it makes sense on a whole bunch of different fronts, and I'm glad New York's doing the same thing.
Thanks. Also, are you looking for a minimum vaccination participation for each group before moving on to the next one? You mentioned that, it's 56% with those 75 plus right now.
I don't think it's so much a numerical minimum, but we want to make sure we're putting the vaccines to use. So at a certain point when you go through that demographic, fewer people of that age group, we found 75 are coming forward. So we want to make sure that every vaccine has a use. So that's when we brought down to 65. And we'll see what the appetite is there over a period of time. But we're going to get people 65 and over vaccinated, and vaccinated as completely as we can.
Thanks. And just one more. Connecticut ranks 4th in first doses administered, but 9th in second doses administered. Do you have a comment on that?
I'll start, and then I'll pass it right to Josh. I mean, we get second doses allocated to us by the federal government. We don't control that. But Josh?
Yeah, the key driver there is that because we prioritize the federal long-term care program as early as we possibly could, we wanted to get our nursing homes vaccinated as quickly as possible using the federal partnership. We had to allocate doses to those vaccinating partners, but the program didn't actually start for a week later. So there's a little bit of a lag built in on the second doses as a function of our desire to get our nursing homes vaccinated as quickly as possible. That'll get caught up soon and get ironed out. But I think all the states, and my understanding is a lot of the states who also prioritize nursing homes earlier are experiencing a similar phenomenon.
Great. Thank you both.
Hearst, Connecticut Media.
Thanks, Max. Can I ask Josh, it seems like the VAMS you're not planning to move away from it. It's becoming less clunky. Is that a better way to describe it? Because I like to use the word clunky.
Yes, we're trying to make it as easy as possible to register to get vaccine, to understand where there are appointments available, to book their appointment. And VAMS works. It's for many people have found it to not be as intuitive, and we empathize with some of those concerns. So we're working to, make it easier for people, but the underlying workload that it carries for us is very important for many of our providers around the state. And so, no plans to change horses there.
What kind of experience are we having with non-English speakers in that?
Yes, well, this is one of the major limitations of VAMS that's been a frustration for us, is it is only in English. And this is why we took actions to ensure that non-native English speakers had plenty of other options. So a lot of our large providers are doing direct outreach and have multilingual support to people who would prefer not to interact in English, and also why we prioritize standing up the call center with the support of the United Way 211 team. Where we have folks who can answer the phone there and speak in multiple languages. So we're working around that and working to ensure we have plenty of options for people.
Thanks. And Governor, regarding the executive order, the way it's written, it makes it seem like that they had previously, the nursing homes and hospitals had like some blanket immunity from liability, but in fact, it was limited protection. Can you get a little bit further into that for me, or
I can get a little bit further into it, Ken, but look, we held nursing homes accountable. As you know, Deirdre and DSS, they shut down one nursing home, fined additional nursing homes. We had GARD and others going in and checking, making sure all the protocols, all the disinfecting was going on, making sure people were wearing their mask. What we didn't do at that early on was we said, you're not going to be subject to lawsuits because we thought there was too much changing, too much uncertainty in terms of what was going on with COVID back during the spring. And that's not the case in February. It's a different situation, so people should be held accountable.
Were there any particular lawsuits that sprang out in the months between then and now?
Not that I know of.
Josh, yeah, Paul, no?
No, nothing to it, no.
Okay, thank you very much.
The Connecticut Mirror.
I just wanted to clarify, when you said the 350,000 residents now would be eligible, 65 or above, that is anybody above 65 as opposed to 65 to 75, is that correct?
I think 65 to 75 is the 350,000, but you're right, Paz. Anybody over 65 is certainly eligible.
Okay, but the 350, that's an additional 350,000 people are now eligible. Got it. Governor, on the closure of Northern, are the savings simply going to go to the bottom line, or are you going to reinvest any of that money in rehabilitative services, such as expanding the True unit at Cheshire or stuff on the front end?
Look, I'm going to make sure the True unit at Cheshire and other rehabilitative services are there. You know, we do have a deficit, so I am trying to use some of these savings to address our deficit as well.
Okay, you're saying you want to make sure they're there, but it doesn't sound like there are plans to expand anything given the fiscal situation. Is that what you're saying?
I'm going to make sure that Cheshire is going right, that we're taking care of people who are getting back into the workforce for sure, but this money is going to go to fix our deficit.
Okay, and are there plans on what to do with Northern?
Paul, do you have thoughts on that yet?
At this time, Paz, like I said, we're only in the investigatory stage right now as in terms of various next steps, but obviously with the population being low and under the direction of the governor and the commissioner, thought it would be best to move in a different direction when it comes to Northern at this time. But in terms of utilizing the facility in a different way, that would have to be looked at in the later months with Commissioner Jabal and the agency as well.
Okay, well, the governor did not react well to the word mothballing, but was that just because he wanted to convey that this is a permanent closure of Northern as a prison as far as he's concerned? But mothballing can simply refer to keeping the building available, should it be necessary.
Yeah, we can go into the technical descriptions of what has to be done when a building is no longer have individuals in it. But I think what the governor is just getting across is just this major policy change of the state of Connecticut when it comes to justice reform, particularly when it deals with Northern.
All right. And Governor, when it comes to maintaining flexibility on vaccinations, as you get deeper into the 65 and above, are there any thoughts as to the standards for comorbidities, whether it be across the board or simply in the more vulnerable populations?
Well, we're certainly going to follow the lead of the CDC, Paz, when it comes to comorbidities. And we are going to focus on those most vulnerable populations. And the healthcare providers know many of their patients who do have comorbidities, so they'll be able to reach out, make sure those folks are included as a priority right off the bat.
Thank you.
The Day of New London.
Governor, I was wondering if, looking at some of the different vaccine providers you have in Connecticut, whether it's local health departments, Yale New Haven Health, Hartford Healthcare, Community Health Center, CVS, which of these providers have already, opened vaccine appointments up for 65 and older today versus which ones are waiting until Thursday? And what have you heard in terms of what providers have already, booked up their appointments today?
Well, my understanding is you're not supposed to be taking the new appointments for 65 and over until Thursday. That's what the deal is. Although, as I pointed out, Erica, there are some places where they have excess vaccines. We don't want them to go to waste, so they were making them available on an ad hoc basis to 65 and over.
Yeah, Erica, if I could just add, as the governor was alluding to, we wanted to make sure that any providers who were seeing any extra capacity in their appointment schedule this week were able to, start booking in 65 and above. But as the governor said, the main day we're focusing on for all of our providers to have their websites updated and their schedules ready to go for the next several weeks for 65 and above is Thursday. It's worth pointing out that a lot of the request to provide that earlier flexibility was coming from some of the cities. As an example, a lot of them are going into senior housing complexes, signing up a handful of 75 and overs, and they're saying, look, we've got vaccine. We'd love to do the 65 and olders while we're there as well. Made a lot of sense, especially in some of the communities where we're really trying to get to quickly. So, that request from a lot of our cities was compelling as well.
Yeah, and I know for some of that, our local health department had booked up for a clinic that's on Friday. So they were booking today for a clinic, happening after Thursday. Then I also had a question on the topic of essential caregivers in nursing homes. I know that's a designation, a program that a lot of people have been pushing for a long time. The Mathematica report listed the designation of essential caregivers as a short-term recommendation to mitigate a second wave of COVID in long-term care facilities, and recommended that DPH issue guidance to facilities for designating these caregivers. So why hasn't that been done yet?
You got that, Josh?
No, I think we'd have to look into that and get back to you.
Okay, I'll check with DPH on that. I know that's something that's being worked out at the legislative level as well, but I don't know if you had any kind of sense of, why that couldn't be done either through executive order or just, guidance from DPH.
Yeah, we'll refer you back to DPH for directly on that one. But I know the first task that DPH has been working on and is about getting as many people vaccinated as possible. But DPH would be happy to follow up with you on that question.
Okay. And then I had one more question about the UK variant. I know a study found that the variant is rapidly spreading in the US. Public health experts initially predicted it would become dominant in the US in March. Is that still the case? And what is the state doing to step up surveillance efforts to identify the UK variant and other?
I can tell you that we are doing a lot of genetic testing here in the state of Connecticut to see what are the nature of the variants that maybe are here. Right now, there's an extraordinarily low prevalence of that here in Connecticut, unlike some other parts of the country, like southern Florida, where they probably have 10 times the percentage of infections related to the variant there than they are here. My instinct is they're not spreading as fast as we may be worried about going back, 2 or 3 weeks, but it is something we're following carefully. I think you saw in England, as you pointed out, Erica, or Britain, it spread pretty quickly. Same thing in Portugal. Right now in the United States, I'd like to think that hopefully Florida stays ahead of it with vaccinations. I think Connecticut will.
Thank you.
All right, I think that's it. I just want you to know if you still have an appetite for great sports after the Super Bowl. This evening, the UConn women are playing an amazing basketball game that will help determine, who's the best women's basketball college team in the country. So you may want to tune into that. But in the meantime, don't take your eye off the ball. We've talked a lot about vaccinations, how important it is you get vaccinated. And here's a PSA from our friend Reg Eady, who can tell you a little bit about why it's important.
Let me take a moment to have a conversation with the brown and black communities. Coming from your community, I completely understand why there's vaccine hesitancy in communities of color. Reality of it all is doing nothing will only guarantee that we will continue to see our friends and family die at a much higher rate. So we've got to do something. So why don't you join me, elbow to elbow, so that we can get back to being the strong community that we have been in the past. God bless you, and let's get this done.
Well said, Reg. Take care, everybody. Be safe.